Greetings and welcome to the Kane County Hand, Foot, and Mouth Disease webinar. This training will provide a brief overview of hand, foot, and mouth disease, including key information for school and daycare staff. Our learning objectives today are to understand the definition of hand, foot, and mouth disease, to learn how to identify symptoms, and to understand hand, foot, and mouth disease treatment and prevention. The World Health Organization defines hand, foot, and mouth disease as a common, mild, and self-limiting disease with symptoms including fever, painful sores in the mouth, and a rash with blisters on the hands, feet, and buttocks. Hand, foot, and mouth disease is found worldwide and usually affects children. It is common in childcare facilities due to poor hygiene, contaminated objects, and close proximity between infected and non-infected youth. Hand, foot, and mouth disease symptoms are generally mild and include rashes on the individual's hands, feet, or buttocks, as well as painful lesions in their mouth and throat. The blisters and mouth sores can make swallowing difficult, and children are often at a risk of dehydration. It may or may not present with fever. The incubation period is typically 3 to 5 days, and the illness typically resolves on its own within 1 to 2 weeks. Here we see pictures of real patients. We see the characteristic rashes on the feet, as well as rashes on an adult's palms. While the disease is most common in children, parents and school staff are also at risk of contracting this illness, especially if they were unexposed to the virus as a child, or if their immunity against the illness has weakened over time. Though severe symptoms are rare, they do occur in some individuals, especially those with autoimmune diseases, and include acute flaccid paralysis, aseptic meningitis, and myocarditis. Stomatitis may also result accompanied with ulcers, further complicating food and water consumption. Infected children will transmit this disease by sneezing, coughing, or touching other children. The virus can spread through nose secretions, throat discharges, saliva, fluid from blisters, stool, and respiratory droplets sprayed into the air after a cough or sneeze. Children and adults may also contract this illness by touching a contaminated item and then touching their eyes, mouth, or ears. Hand, foot, and mouth disease occurs year-round, often in the summer and early fall. High and low temperatures have been associated with hand, foot, and mouth disease incidence. Precipitation and humidity have also been thought to promote hand, foot, and mouth disease as they improve the microenvironment needed for viral survival. While hand, foot, and mouth disease is clinically diagnosed, laboratory tests are done to confirm the diagnosis during suspected outbreaks. Healthcare staff will typically run confirmatory laboratory tests using reverse transcriptase PCR on patient samples such as blister fluid, throat swabs, or stool. Because there are other illnesses that have similar symptoms to hand, foot, and mouth disease, parents are advised to monitor symptoms for progression and to seek the advice of their physician. Because of the risk of dehydration, it's important to ensure the child or infected individual continues drinking water and consuming food. Given the lesions in the mouth, swallowing can be painful, so doctors recommend feeding children a diet of soft foods and cold beverages. As we stated earlier, this illness is usually mild and resolves on its own. To avoid infecting other children, infected children should be isolated until they are symptom-free for 24 hours without medication. Also, because this is a viral infection, parents should refrain from requesting antibiotics from their physicians, as these will only work on bacterial infections. Because there is no vaccine for hand, foot, and mouth disease in the US, an important strategy to preventing the spread of hand, foot, and mouth disease is to ensure that youth are educated on personal hygiene, especially regarding hand washing, covering their nose and mouth when sneezing, and disposing of contaminated waste. School and daycare staff should monitor youth during hand washing to ensure that they are clean after sneezing, using the restroom, and before eating. School and daycare staff should also wash their own hands after cleaning diapers, handling anything soiled with stool or mouth secretions, and before preparing and or eating food. School and daycare staff should frequently clean and disinfect communal areas and shared surfaces where contamination and disease transmission is likely, such as toys and countertops. Individual hand, foot, and mouth disease cases are not reportable. However, if 10 suspected or confirmed epidemiologically linked cases of hand, foot, and mouth disease are observed, they should be reported within 10 days to the local health department. They can be reported to the Kane County Health Department by calling them at 630-208-3801. Please keep in mind that epidemiologically linked cases are cases in which a person has had contact with another individual or individuals who have been identified as having hand, foot, and mouth disease, or who have been exposed to the disease-causing agent. Another important prevention strategy is to isolate infected children from schools and daycare settings. According to Illinois Department of Public Health's published guidance, children should be excluded from daycares or school settings if they have a febrile illness or other symptoms meeting exclusion criteria, or if they are unable to maintain hygiene or avoid contact with others. Section 407.310 of the DCFS licensing standards of daycare centers outlines when a sick child should be excluded from daycares. According to this guidance, children should be excluded if they have an illness that prevents a child from participating comfortably in program activities, an illness that calls for greater care than the staff can provide without compromising the health and safety of other children, if the child is exhibiting fever with behavior change or other symptoms of illness, or if the child has exhibited unusual lethargy, irritability, persistent crying, difficulty breathing, or other signs of possible severe illness. For additional information on other diseases, please refer to the Communicable Disease School Nurse Guidelines document posted on the IDPH website. To report a cluster of hand, foot, and mouth disease cases, please contact the Kane County Health Department either via phone at 630-208-3801, via their email address, school@kanecountyillinois.gov, or via fax at 630-897-8128. Please ensure reports include the disease being reported, the patient's age, sex, ethnicity, the patient's name, address, telephone number, the physician's name, address, and telephone number as well. To learn more about hand, foot, go to the CDC's website at www.cdc.gov/hand, foot, and mouth disease/index.html. For more information on this illness, you can also visit the Kane County Health Department's website at kanehealth.org. Thank you for participating in today's hand, foot, and mouth disease webinar and for helping to prevent the spread of this disease.